When Medicare was established in the year 2000, Kazakhstan had only been an independent nation for a little more than 8 years. The infrastructure the country inherited from the Soviet Union was fairly developed, including its healthcare system, but a dire economic crisis in the 90s brought a shortfall of funding, professional staff, and equipment. By the 2000s, however, revenue from the oil and gas industry allowed Kazakhstan to begin to restore its weakened healthcare system with increased investment. Essentially, Medicare's path to growth has paralleled the overall growth and revitalization of the entire healthcare industry in Kazakhstan. Though Medicare has remained a private organization, along the way we've been able to very effectively align our development with new government programs and reforms. Today, Medicare is the largest private healthcare provider in Kazakhstan. Here, in the 9th largest country in the world, the company can be found in every region. In addition to 27 clinics, the Medicare ecosystem includes a number of subsidiaries. The industrial medicine provider Medicare Industry, IMED, a specialized institute for training and accrediting staff, Medilab, a medical supply company, the M32 network of dental providers, Medicare medical assistants, and more. The company's indicators demonstrate steady growth, new facilities are being commissioned every year, and the range of services continues to expand. Yet, Medicare's main mission has always been improving our country's healthcare system as a whole. We feel that our duty is greater than just that of a private organization. That's why we're directly invested in providing the highest quality medical services to the most vulnerable segments of the population. At Medicare centers, 52% of patients receive their treatment completely free of charge, thanks to a state program that guarantees free healthcare to the public. This share is increasing with every year. Since 2019, the percentage of patients with government healthcare has increased by half, while the share of customers paying out of pocket still sits only at 11%. With this model, we are able to create conditions that are quite unique. We can take the same high-quality standards that one expects from private clinics, yet provide them to the general population at no cost out of pocket. We take a similar approach to working with the government through our clinics managed through public-private partnerships. As part of this agreement, Medicare takes over the management of existing healthcare facilities. Thanks to more efficient management practices and investments in equipment and personnel, we're able to significantly overhaul the medical care provided, while the public access to these crucial services remains unhindered. For our company, working within the framework of a public-private partnership is a major step. We see it as confirmation that we're not only leading players in the private market, but in the national healthcare industry as a whole. Kazakhstan's economy is overwhelmingly based on exporting petroleum and mineral resources, so the oil and gas and mining industries are strategically important. Providing medical care for the entire sector is one of Medicare's top priorities. Every month, more than 400,000 industrial workers undergo medical examinations at first aid posts set up by Medicare, including at remote work sites. Needless to say, the efficiency and safety of production at these sites depends on the quality of these inspections. To increase the capacity of medical posts and reduce the human factor, this process was automated with the help of our own automated inspection system, Med365. Overall, if you take an industrial town in Kazakhstan, it's a Medicare clinic that's going to be the closest and best equipped. That goes towards making our brand a unifying force, something meaningful to the community, even for those who aren't employed by that local industry. The COVID-19 pandemic began in Kazakhstan as much as it did anywhere else, with a dangerous lack of reliable data and an abundance of misinformation, confusion, and panic. Working together with our South Korean partners, MPK, Medicare was the first in the country to provide drive-through and walk-through PCR testing sites, rapidly deployed within only a week. Data from these testing sites would become the first on-the-ground information that the government could work with. With these crucial statistics, critical decisions were made to reduce the pandemic's damage. At Medicare, we see our company's growth as inextricably linked with the growth of our country's healthcare system. For our management team, our ultimate goal is more than just strengthening our market position or diversifying our business. It's something bigger. We want to play a leading role in developing Kazakhstan's national healthcare system, setting an example by continuously improving the quality of our services, spearheading innovation, and eliminating stubborn inequalities.